This is the story of a massive healthcare fraud scheme. It was orchestrated by a medical doctor, a man entrusted with the health and well-being of his patients. That man was Dr. Jorge Zamora-Quezada, a rheumatologist practicing in South Texas. His actions led to devastating consequences for countless individuals. Ultimately, his scheme was exposed, and he was sentenced to a decade in federal prison. But the impact of his fraud continues to resonate. Give a like and subscribe. Leave a comment. The nature of this scheme was a massive, long-running healthcare fraud operation. It was built on a foundation of deception and exploitation. The primary method involved falsely diagnosing patients. Dr. Zamora-Quezada claimed they suffered from serious chronic conditions. Specifically, he falsely diagnosed many patients with rheumatoid arthritis, or RA. This is a debilitating autoimmune disease requiring significant treatment. The sole purpose of this elaborate scheme was to fund a lavish and extravagant lifestyle for the doctor. Patient care was secondary, if considered at all. This fraudulent operation continued for nearly 2 decades, preying on vulnerable individuals and defrauding insurers. Over its duration, the scheme involved approximately $325 million in fraudulent claims submitted to various healthcare payers. From these claims, more than $118 million was actually paid out by insurers for services that were not medically necessary. Dr. Zamora-Quezada ruthlessly exploited the trust patients placed in him. They came seeking help, and he saw only opportunity. He subjected these patients to unnecessary treatments and tests. These procedures were not aimed at healing, but at generating revenue. The types of treatments and tests administered included toxic medications. These powerful drugs carry significant risks and side effects. He also ordered frequent injections, infusions, X-rays, MRIs, and other invasive and costly procedures. Crucially, these procedures and tests lacked any medical necessity. They were performed solely to bill insurance companies. One method of deception involved fabricating medical records. Patient charts were altered to support the false diagnoses and treatments. He also directly lied about patients' conditions to insurers. This was done to justify the fraudulent claims and ensure payment. The targeted insurers included major government programs like Medicare, Medicaid, and TRICARE, as well as private insurers like Blue Cross Blue Shield. The ultimate goal was simple: to receive payment for these unnecessary and often harmful services. The impact on patients was profound and devastating. They were told they had a lifelong incurable condition like rheumatoid arthritis. This false diagnosis caused immense psychological impact. Patients lived with the fear and uncertainty of a serious illness they didn't have. It led to significant emotional distress. Patients grappled with the reality of a chronic disease and the prospect of lifelong treatment. Beyond the emotional toll, the unnecessary treatments caused significant physical distress. Patients suffered debilitating side effects from toxic medications and procedures. Specific side effects reported by patients included strokes, jawbone necrosis, and severe hair loss. Other patients experienced liver damage and chronic severe pain as a result of the unnecessary interventions. Patient testimony revealed the depth of the suffering. One patient described feeling that life had no meaning, constantly confined to bed due to the false diagnosis and treatment effects. Another patient's mother recounted feeling her child was treated like a lab rat, subjected to experimental or unnecessary procedures. Other patients felt like they were living a life in the body of an elderly person, experiencing premature aging and physical decline due to the treatments. The fraud extended beyond patient care into the work environment. Dr. Zamora-Quezada created a toxic and fear-filled atmosphere for his employees. He pressured employees relentlessly to meet quotas for procedures. Their jobs depended on generating revenue through patient visits and treatments. He threatened employees, many of whom were on work visas. He warned them with firing and revocation of their visas if they dared to speak out or question his practices. This created a climate where employees were complicit or too afraid to report the fraud and abuse they witnessed daily. When investigators began looking into his practice, Dr. Zamora-Quezada engaged in obstruction of justice. He instructed employees to fabricate missing records, using the term aparecer, meaning to make them appear. The handling of patient records was appalling. Records were stored in unsanitary conditions, including a dilapidated barn. These vital documents were found amidst feces, urine, rodents, and termites, highlighting the doctor's utter disregard for patient privacy and professional standards. The legal consequences for Dr. Zamora-Quezada were significant. In 2020, he was found guilty on multiple federal charges. He was convicted of conspiracy to commit healthcare fraud, multiple counts of healthcare fraud, and conspiracy to obstruct justice. Following his conviction, he received a substantial sentence. He was sentenced to 10 years in federal prison. In addition to his prison term, he was ordered to serve 3 years of supervised release upon his release. The court also ordered him to forfeit approximately $28 million in assets. These assets were deemed to be the proceeds of his criminal activities. The forfeited assets included 13 real estate properties, a private jet, and a Maserati sports car, illustrating the lavish lifestyle funded by the fraud. His medical licenses were also revoked. He is no longer permitted to practice medicine in Texas, Arizona, or Massachusetts. Expert testimony during the trial underscored the severity of the fraud. Other rheumatologists testified to seeing hundreds of his former patients who had been falsely diagnosed. These experts confirmed that these patients did not have rheumatoid arthritis. They were victims of a deliberate misdiagnosis. One doctor stated that it would have been obvious to most competent physicians that these patients did not have RA. This highlighted the intentional nature of the fraud. At its core, this case represents a profound betrayal of trust. Dr. Zamora-Quezada exploited vulnerable patients who relied on him for care. His motivation was clear and singular. He prioritized personal gain and greed over the well-being and health of his patients. The overall impact of his actions is staggering. He caused physical harm and emotional trauma to countless individuals. Simultaneously, he stole millions of dollars from taxpayer-funded programs and private insurers, enriching himself at the expense of the healthcare system and its beneficiaries.